Content warning. This podcast episode contains discussions of a sensitive nature that may be triggering for some individuals.
5, 4, 3, 2, 1. Let's go. Diary of a Kidney Warrior podcast in partnership with Kidney Care UK, sharing faith, knowledge, hope, and love.
Hi, and welcome to Diary of a Kidney Warrior podcast. My name is Dee Moore, and I am a kidney warrior. This podcast is dedicated to encourage, educate, and inspire as we explore all aspects of kidney disease, related chronic illnesses, and health. If you have any questions or ideas for topics you would like me to cover, please get in contact with me on social media using the handle Diary of a Kidney Warrior. Diary of a Kidney Warrior podcast celebrates Black History Month, and today's episode focuses on kidney health and the Black community. My guest today from Manchester, England, is an award-winning senior nephrologist, Professor Ibi Erekosima. Professor Ibi is involved in global renal care and has pioneered the sustainable development of the prevention of CKD in Sub-Saharan Africa. Professor Ibi has a specific interest in the interface between hypertension, diabetes, and CKD. Professor Ibi joins me today to share about the link between hypertension and chronic kidney disease and the Black community. Hi, and welcome back to Diary of a Kidney Warrior podcast. How are you doing today, Professor Ibi?
I'm very well, thank you. And you?
I'm good. I'm really excited to talk to you today. Listeners, this is the second time that I've had the honor and privilege to interview Professor Ibi on the podcast. The first time was episode 83, where we talked about sickle cell anemia and chronic kidney disease. So do check out that episode. You'll learn so much about both sickle cell and CKD. So yes, do check out that episode. So today, as part of the Black History Month celebrations, we're going to be talking about the link between hypertension and chronic kidney disease, CKD, in the Black community. I do have to start with a disclaimer that we're not giving medical advice during this interview. Consult your consultant, your medical team for specific medical advice. What we're giving here is for educational purposes only. As everyone knows, I always like to start the health professional interviews with definitions, because I think we can't take it for granted that everybody truly knows the meaning of what we're talking about. So we use the word hypertension, or quite often people will refer to it as high blood pressure, but really, what does it mean? So my first question is, what is hypertension?
That's a very important question. Of course, you have to make people understand the meaning of hypertension. In other words, high blood pressure. And the definition the definition worldwide and globally is that hypertension is generally considered to be defined in figures. And so we have a figure of about 140/90 millimeters of mercury. That's how it is measured. And that figure is now compared to the reference figure, which is classed as normal, which is between 120 and 130 over 80 to 90. So in that sense, high blood pressure is defined as when your blood pressure is greater than 140/90, and usually measured in the clinic, hospital, or any healthcare facility. But I just want to say that some people believe that if you measure your blood pressure at home blood pressure reading, and if it is more than 135/85 or higher when measured at home, which is the home blood pressure reading, may be classed as high blood pressure also. But to make it simple, blood pressures are above 140/90 millimeters of mercury, and that's what we use to measure blood pressure.
Right. So normal blood pressure would be 120 to 130/80. And then high blood pressure is anything above 140, above 90.
That's correct.
But then you said some people say that if you're measuring it at home, it's anything above 135.
85 to over 85.
Over 85. Why is there a difference between the home one and the clinic one?
It is believed that at home, your blood pressure is supposed to be better than in a clinic setting. Because in a clinic setting, people are a bit anxious. And that's what we call, sometimes some people go to hospitals and their blood pressures shoot up to the roof. And that's what we class as white coat hypertension, because they see the healthcare professional. But if you're at home, you're relaxed. And so when you take it and if blood pressure is still above, say, about 135 or 85, we may begin to suspect that you have high blood pressure and need to monitor you to see how we can look after the patient.
So I've heard about white coat syndrome. So that's literally people's blood pressure shoots up because they see a doctor and then they feel stressed out. And so it would appear that they have high blood pressure, but they don't necessarily.
Yes. That's something that we have to be careful about, because some people, though they have white coat syndrome, truly may have high blood pressure. And so the blanket definition of white coat hypertension is when you go to the hospital and you see a healthcare professional, not necessarily be a doctor, a nurse, or a healthcare assistant who is taking your blood pressure, and blood pressure goes up on a consistent basis. And then you're not classed as white coat syndrome. Now, in order for you to make a definition of white coat syndrome, what we healthcare professionals do is that we put a 24-hour ambulatory. Ambulatory means that you keep it and be going about your business for 24 hours. And if the blood pressure is okay, then we can now confidently diagnose that when you come into the hospital and your blood pressure goes up, truly it's white coat syndrome.
So now that we've looked at the definition of hypertension, how serious is the incidence of high blood pressure across the world and in the UK?
There is this saying that hypertension is a silent killer, because most hypertension doesn't cause any symptoms. And so if you look at the WHO figures and compare to other parts of the world who have done individual studies, WHO global estimates show an estimated 1.2 billion adults aged 30 to 79 have hypertension, with 2/3 living in low and middle income countries.
1.2 billion with a B.
Yes, with a B.
Wow. That is shocking. That really is shocking to hear.
Now, let me tell you more about that. More about this that will be even more surprising, that awareness among this adult population who have hypertension, 46% of this figure are unaware of their condition. So almost half of them don't know that they have high blood pressure.
So that's very similar to CKD, where you can lose up to 90% of function with no symptoms.
Yes. So hypertension is a serious disease, and this interpretation, especially in some parts of the world, especially in Sub-Saharan Africa, and even in some other ethnic Black populations like the Caribbeans, and even among the African Americans, it is always thought that you get high blood pressure because you're thinking, or you have some loss, either finance or a loved one is lost, or something is, or you have a problem with job loss or something, that is what is causing high blood pressure. So people think that it is a circumstantial thing, but actual hypertension is a disease.
I think that the majority of people would be very surprised to hear that it is actually a disease. That most people think that hypertension really is a form of stress. Like, this has gone wrong in my life and I'm stressed about it and my blood pressure goes up. I think many people, and I mean, I can only speak for myself, but I think that most people would actually think that it is circumstance that causes high blood pressure rather than it actually being a disease. Wow.
If I might just add, sorry to interrupt, is that even more surprising is that less than half of adults with hypertension are underdiagnosed and treated. That's where it is even more surprising. Almost 50% are unaware, and half of the population who they've classed as hypertensive, half of them are undiagnosed and getting any form of treatment. And this is more common. If you listen to my prevalence, if you just remember what I said, that about 2/3 of the global prevalence of hypertension, of people who have hypertension, 2/3 of people live in the low and middle income countries.
So basically, what you're saying is that there's a higher incidence of high blood pressure in lower and middle income countries.
Yes.
So why is that?
That's because the disease is due to multifactorial causes, which is not just one cause. There are multiple factors that is responsible, and one of them is socioeconomic. And that's why it seems as if it is more common in low and middle income countries.
So what do you mean by socio-economic?
So economic means that because, people don't eat. I mean, people from lower socioeconomic countries, their lifestyle is poor. They eat very unhealthy foods and all that. So they don't have a lot of awareness of eating healthy food. So they use a lot of these salts to sit in their foods and all that. And so that is contributing to the blood pressure. And so, like I said, it's due to multiple factors. So there are other things that will accelerate hypertension in those communities. One of them is genetic, which I will talk more about in the course of the discussion.
So if we're looking at the Black community specifically in terms of causes of hypertension, what are they?
If you look at the causes of hypertension, it is said that 85% of people who have identified as having high blood pressure is unknown. Now, the reason why we say it's unknown, that you can't pin it to something, to one thing. So it's a multiple factors. But one of the things that I will mention is genetic predisposition. Because from studies, it's been found that the Black ethnic population tend to retain salt and water. And so their kidneys are designed to retain salt and water. And they're ascribed to genetic reasons. So their genetic make them want to retain salt and water. So in the presence of that and other factors like lifestyle and eating habits and socioeconomic factors all put together, and environmental factors will predispose this community to a higher blood pressure than other ethnic communities.
So looking at the Black community specifically, how does lifestyle cause high blood pressure?
Lifestyle, especially if you look at specifically to eating habits and dietary habits of the African and Caribbean ethnic population, their food contains a lot of salt because they use most of these spices that contain a lot of salt to cook. So that is something that is quite prevalent among Black ethnic population.
So the seasonings that are used to season the foods contain high levels of salt. So this is a contributing factor to hypertension. So what other lifestyle factors cause hypertension?
I mean, the other lifestyle factors that you think about is lack of exercise, and you look at weight gain from high carbohydrates kind of diet that we eat. You look at alcohol and smoking, although that's not different from other ethnic populations, but in the presence of genetic predisposition, those things will accelerate your getting high blood pressure.
So what you're saying is the Black population is no more likely to drink alcohol or smoke than any other population, but because of the genetic predisposition, then it's more likely to cause hypertension in the Black population.
I'll put it like that, not cause. I'd say it contributes.
Contributes. Okay.
Yeah. So, yeah. Having said that hypertension has genetic predisposition and lifestyle and other factors, it's multiple factors. So those group of people that have that kind of hypertension, we class them as essential hypertension, and they make up about 85% of those of adults that have hypertension. Now, of the other 50%, we class them as secondary hypertension. Now, why do we call it secondary? Is because there's an identifiable cause. And identifiable causes are, number one, it could be endocrine. So it could be something wrong with the adrenal gland in conditions we call Cushing syndrome. You also have in conditions where we call you're releasing certain abnormal chemicals like adrenaline and noradrenaline. So that will raise your blood pressure. And also in situations where you have narrowing of your blood vessels to the kidneys. So the kidneys doesn't have enough blood supply. So that's what we call a renal artery stenosis. That is your narrowing of your blood vessels to your kidney. And there are people who are born with narrowing of their blood vessels, which are arteries in different parts of their body, especially the blood vessels that come out of the heart, which we call coarctation of the aorta. Those people can have high blood pressures. So those happen mainly in young people. And one thing that I also want to mention is that when you have an intrinsic kidney disease, in which case it's not high blood pressure that is causing the kidney disease, it can cause high blood pressure. That's why most times it's what we call chicken and egg, which comes first. So you have a kidney disease and you have high blood pressure. What caused what? So sometimes it's difficult to know.
So what you're saying, in the vast majority of cases, so in 85% of the cases, there's an unknown cause of the hypertension, but in 15%, there is a definite cause. But this 15% tends to be young people.
Yeah, young people, yes.
So in that case, in regards to age then, what age should you start testing your blood pressure and keeping an eye on your blood pressure?
The essential hypertension actually affects people, in all the age group from age, say, if we look at from age above 30, 35 and above, especially in Africa. So from 35 and above, you should start taking a conscious effort to check your blood pressure. So when we say up some of the young ages, those that are in teenage age, up to 30 years old, anybody that we see with hypertension at age below 35, even below 40, we want to investigate for a secondary cause. So you hardly find somebody who has hypertension above 40 years due to a secondary cause. It's not a common thing to find above that age group of 40. So in essence, what I'm trying to say is that as you grow older, once you get above 35, it is advisable that you should make conscious efforts to check your blood pressure. As well as get 40, yes.
Is that because it becomes harder to identify as you get older?
No, it's not that. It's because essential hypertension usually doesn't, you wouldn't know you have high blood pressure. But if you have secondary hypertension, maybe there will be other things that might show that, because the secondary hypertension has a cause, so it may have other symptoms.
So in the same way that you can get to 90% of loss of kidney function without symptoms, a very similar thing with hypertension, that when there's a secondary cause, those symptoms will flag it up.
Yeah, there are other symptoms. For example, if you have an endocrine disease, of course, it's not going to be only high blood pressure that will be the symptom of that disease. You could have other things that will go with it.
So we've talked about the high incidence of high blood pressure worldwide and in the UK. But what are the implications of having high blood pressure?
Okay, unidentified high blood pressure has a certain target organ implication. The organs that are affected mainly are the brain, the heart, and the kidneys. And the eyes also is affected. And sometimes in patients with hypertension, at a certain age, you also notice that they are beginning to show signs of diabetes. So that is something that you should be aware of. So most people that develop hypertension at a later age, you should be checking for diabetes, which is checking their blood sugars and all that as part of your monitoring. So the target organs that it affects most is the brain, the heart, and the kidney. The brain, it causes strokes. and the heart, it causes heart attack, which might lead to heart failure, and the kidneys, it causes chronic kidney disease and leading to end-stage renal disease or dialysis and transplant.
So very, very, very serious consequences there of high blood pressure. I mean, stroke, heart attack, kidney failure, those are very, very serious consequences. How do you treat high blood pressure to avoid it getting there?
High blood pressure, usually we look at, when you're treating high blood pressure, we want to look at the non-medication treatment, which is non-pharmacological, which is you're not taking medication and then you're taking medications. So in my view, that just giving the patient medications to bring down their blood pressure is not complete without the modification of their lifestyle. So modification of their lifestyle, those are changeable factors in which you have to look at their diet. They should change the diet and having less salt in their diet. They also be eating more of fruits and vegetables and all the healthy type of foods. In which case, the reason being that when you're treating the high, you won't use many medications if they are also using lifestyle modification. There will not be many medications. So they will have to deal with their weight. You also look at alcohol and exercise. So all this put together, including if they are smoking, stopping smoking, take that. And then on top of that, you start them on medications, and then you'll be able to monitor them for a lifetime. So treatment of high blood pressure is lifelong. It's not something that you have to take and then stop. But the thing is that if you intensify your lifestyle modification, you may use less medication.
Right.
Yes.
So the more you change your diet and exercise and things like that, cutting out smoking, cutting out drinking, then the less medications that you would need to take.
Yes. Now, one other point I want to make is that if it's a newly diagnosed hypertension, some people might even try lifetime modifications first for the first 6 months to see whether it will help you. But once they notice that that is not helping, the message that we normally give is that you should start all together. Start lifetime modification and pills. So what happens is that if your lifetime modification is effective, you take very minimal pills.
So for the people who they've done the lifestyle modification, they've adjusted their diet, they've adjusted their exercise, they've done all of that, but unfortunately that hasn't worked and they have to now take medication. What is done then?
Okay, so they will be on medication. And I just want to make this point also that if you want to start medications on a patient with high blood pressure, if that patient is from a Black ethnic background, the first line treatment is different from somebody from a non-Black ethnic background because of their response to certain medications for blood pressure.
So what category of medication does that fall into?
Okay, so when you're treating somebody for high blood pressure, we give certain medication. We have different classes of medications. We have what we call the calcium channel blockers and thiazides, which thiazides make you pass water a lot. And then calcium channel blockers kind of open up your blood vessels. Now, there's another group of medicine called ACE inhibitors, which kind of dampen some chemicals in your blood that is released by the kidneys. You understand? So it's been found out that that is more effective. That particular one is more effective. The ACE inhibitors is more effective in Caucasians compared to Blacks, where we use the calcium channel blockers and these water tablets called thiazide. If you remember, I said they retain salt and water.
So that makes sense then, because if there's a genetic predisposition to retain water, then the medications that you take will have a diuretic effect to get rid of that water, which is contributing to the high blood pressure. So yeah, that makes sense.
Yeah. Exactly. So ultimately, it's an individualized treatment. So when we're assessing patients, we take we take those things into consideration and tailor the treatment to the individual. And if I've just had another point that when we're treating high blood pressure, so once there's a target organ damage, either the brain, the kidneys, or the heart, it also changes some of the tablets that we give for the blood pressure.
So you mentioned before that the treatment of hypertension is a lifelong thing. So once you take the medication and your blood pressure comes down, you don't stop taking the medication, you still continue taking the medication. What would be the consequence of you stopping taking the medication? I mean, is it a simple case of it goes back up and you take it again and then it comes back down? Or would you actually cause more damage by doing that? I mean, what is the real implication of not continuing with consistent treatment?
If you look at the way your blood pressure swings during the day and at night, it's advisable that if you're hypertensive, you must take your blood pressure, because the next thing you will see, you probably wake up in the morning and get boom, you get a stroke. You could get a heart attack. I mean, over time, you could find out that your kidneys are working at a very low percentage. So I think it's advisable that it's a progressive thing and it will cause further damage. Now, one thing that you should also realize is that not taking your medications is the risk several times over. So you must endeavor to take your medicines, because the consequences of damaging those three key organs is very high. Now, we just mentioned that. To be fair, there are other reasons why, there are quite valid reasons why some people don't take their medicines. Some of the blood pressure tablets have side effects, and those side effects can affect your quality of life, especially among men. You could have people developing erectile dysfunction, which we call ED, and that could make somebody abandon their treatment because obviously it affects their quality of life. And sometimes some people, they may not say it, but they may take the medicine and it makes them feel woozy in their head. And so in that case, you need to discuss with your doctor to reduce your tablets and advise you of the best to take it, and then monitor you properly to get the appropriate dose for you for that particular medication. But the good news is that most of the medications for high blood pressure now are better than several decades ago. Although they still have the side effects, we still have compliance issues, especially among males because of what I've just mentioned, and that they develop ED, which is erectile dysfunction. And so that is one of the commonest causes among men not to take their medicines.
As everyone knows on this podcast, we like to cover difficult subjects as well. So circling back to that point, so in the incidents that taking the high blood pressure medication causes ED, I think anyone listening would understand why a male in this case would not want to take the medication because of that consequence. How do you then get around that? So you're encouraging this individual, you're saying you've got high blood pressure, you need to take this medication, and he's saying, well, this is affecting my function. So what can be done about that?
But I think firstly, when you start them on the treatment for high blood pressure, you need to discuss the side effects. You need to preempt them that this is something that they may experience, but there is a way around it. So you need to also explain to them that the benefits of taking the medicines far outweighs the risks that they're going to face of ED. So one of the things that you can offer them when they have that problem, in the absence of any heart complications, they have an uncomplicated hypertension, if they don't have any heart disease or thereabout, because some of these that are used for treating ED can cause fast heart rates, and so can affect the heart. And so in the absence of that, you can prescribe safely this treatment to help them with that symptom of ED. So that is an option. they can offer them.
So there is hope.
Yes. But the thing is that what I've experienced in my practice for several years is that there are a lot of cultural setbacks. So people often don't come to tell you why they don't take the medications. They might just say, oh, they don't feel well. It has to do with some cultural kind of, how will I describe it, cultural setbacks, where they're not very open to discuss that with their doctor, that they have ED, So compared to certain cultures where people are more open and say, this is my problem, can you solve it? That's why I'm not taking it. But I think within our Black communities, that's not something that people come up with very quickly. So I think what you do, you recognize that and need to encourage them that if they have this side effect, they should seek help. The other thing that I will want to mention, especially among Black ethnic communities, is that they frequently take herbs. And so thinking that hypertension is curable, I've had several educational meetings trying to enlighten people that those herbs cause more problems. And so what I will advise is that you should try and avoid herbs that are of no value to bringing down your blood pressure. No matter what people say, I mean, there's lots of information now on the internet, which most of them are misinformation. You still will live longer if you listen to your doctor and take your medication in terms of the complications. So although some people argue that living a healthy lifestyle, of course, that is important. But if your blood pressure will require medications, you need to take medications, and that will be decided by your doctor. And if you look at the global prevalence of herbal medications, it's more common in Sub-Saharan Africa and some parts of the Caribbean and Asia.
So rewinding slightly, you said that hypertension is the silent killer because people don't get symptoms. Very similar to CKD in that way. But what are the symptoms of hypertension? What are the symptoms that people should look out for?
Majority of patients don't have symptoms. The only time you have symptoms is boom, you have a stroke. Boom, you have a heart attack. People don't know that. And there are people that don't know. I mean, with people that don't know that they have hypertension until they go to the hospital and find out their creatinine is about 1,000. And they take their blood pressure is in the roof. Their kidneys are gone. So majority of the time, it doesn't give any symptoms. And so I would say that when you see reach a certain age, you should be proactive rather than being reactive to check your blood pressure. Now, that's point number one. Point number two is that some people, hypertension may present with headaches. That's a common symptom. And the interesting thing is that some people, even they have, especially I've seen in some of my relatives back in Nigeria where they've said that they have a headache. I think their blood pressure is up. And then they will now go and take their blood pressure pills. The headache disappears and they stop taking their blood pressure tablet. So that's massively dangerous because the next time they see they will have a stroke, So that's what happens. So the commonest symptom, if at all, is headache.
Something I feel very strongly about is prevention. We've talked about the lifelong treatment, but what is a way that you can prevent hypertension?
You can prevent hypertension from the basics. I mean, we did mention that hypertension is caused by multiple factors. You have a genetic basis, and you know that your father had hypertension, your mom had hypertension. So you can't just be piling up your weight. You cannot be living a sedentary lifestyle. You cannot be living a sedentary. Already the signs are there that you're likely to be hypertensive because of family history. And so you begin to consciously look after yourself by living a healthy lifestyle, reduce the salt in your diet, reduce alcohol, stop smoking. So those things are the things that will prevent you from getting high blood pressure. There are certain situations where you can reach a certain age that your blood vessels begin to stiffen. That in that time, you don't have any choice. It will happen, especially when you get into your 70s, especially when you have an increased predisposition to having high blood pressure. But I think the key message here is that if you have a strong family history, you must begin to be proactive rather than reactive. That's number one. Number two, even without a family history, you know that there's a certain age you are more predisposed to having high blood pressure than another ethnic group. So by the time you're 35, even buying a simple blood pressure kit and putting it at home and check it probably twice a month will be something that will be useful to you or helpful to you. So when you go to see your GP, you say, well, I think I've noticed that over the last 2 years, my blood pressure has gone up to this level. So what do you think I should do?
So tying this all together, because the topic of this episode is the link between hypertension and CKD and the Black community. How does hypertension connect with CKD?
Okay, so hypertension is probably the second most common cause of chronic kidney disease, that is CKD, in the world. If you look at the Black ethnic communities outside the UK, it's the commonest cause of CKD. So that is more reason why you need to take proactive measures to ensure that you don't have high blood pressure, or even if you have it, is well managed, because it's the second most common cause of chronic kidney disease worldwide. So that's the link between hypertension and CKD. Now, the other point I want to make is that having CKD could cause hypertension if you didn't have hypertension before. So a lot of times, by the time patients come to see us as a nephrologist with their CKD, we don't know whether it's the hypertension that caused the CKD or the CKD caused the hypertension. Well, sometimes we know that from doing their scans and things to see, and then do some further tests, we'll be able to know, but do some further imaging of their kidneys. We may be able to find out through some imaging. But most of the time, we don't know whether it's the hypertension that causes the chronic kidney disease or the chronic disease causing the hypertension. But majority of the times, we do assume that it's hypertension that causes the CKD. Now, the other thing too, you should know that because of the prevalence of hypertension in the Black ethnic communities, they are 3 to 4 times more likely to have CKD than their Caucasian counterpart.
So definitely there's a clear link between the two. So the reality is there's a high incidence of hypertension within the Black community and a high incidence of CKD within the Black community. So if you can prevent one, then you can potentially prevent the other. So ultimately, very important to be taking care of yourself. And as you said, diet, exercise, looking at cutting out smoking if you smoke, cutting down alcohol if you drink. All these measures really play a part in preventing both of them.
Yes, that's correct.
So what myths about hypertension do you want to debunk?
Busting the myths is something that I always talk about when I go and give talks on hypertension and chronic kidney disease. Because point one is that hypertension is not a temporary illness that will resolve. That's point one. So that means that you must take your medications. That's one myth. And people think that a lot of us from our ethnic background, Black ethnic background, think that hypertension is a temporary illness that will resolve. It's not. Now, number two is that the absence of headaches or dizziness does not mean good blood pressure control. So, for example, if you don't have headaches or dizziness, it does not mean that your blood pressure is well controlled. You need to measure it and liaise with your doctor to monitor your blood pressure. So if you are having headaches before, you are one of those that had symptoms and you don't have symptoms again, does not mean that your blood pressure is under control. So it needs to be monitored in liaison with your doctor. Number three, that there's no need to experiment with stopping treatment to see if symptoms will reoccur. So for example, you have a headache, so the symptoms disappear, so you want to experiment, but okay, let me not take it and see whether my symptoms will reappear again. So that is something that people should be aware. So don't experiment with hypertension because the consequences are disastrous. As I mentioned before, those 3 target organs can change your life completely. Number 4 is that do not stop medication because of lack of symptoms. So for example, you're taking medications and because you don't have symptoms again, you stop it. So this is different from experimenting. They're stopping whether the symptoms will reoccur again. So they're similar, but they're different. And then the other thing, do not wait for symptoms before you take your medicine. So for example, they give me blood pressure tablets. I'll just wait until I get headache, then I go and take it again. Yeah, so don't do that. And then long-term medication is not harmful. But it may have side effects, like we did explain with ED in males. That could be resolved if you discuss with your doctor. And it does not have any risk of tolerance, meaning that depending on the drug, which you build up in your body to cause harmful effects. No, it doesn't. So like it may have side effects, and that side effects, they can change it to another type of medication that will suit your body. Like I mentioned in this podcast, that hypertension management is tailored to individuals. So no two people, please don't go and take your neighbor's blood pressure tablet and, oh, well, give me some, let me take. So you need to see a doctor to tailor your blood pressure tablets to yourself. And finally, alternative medicines are not more effective, but may result in complications too little, too late. So please avoid alternative medicines. I know there are a lot of beliefs around herbal medications and all that, but in my several decades of practice, it has never done anybody any good. So rather than that, people present with organ damage. It may be too little, too late. So those are the myths that I want to explain.
We've covered so many topics within this subject of the link between hypertension and chronic kidney disease and the Black community. We've looked at the definition of hypertension, the incidence of hypertension worldwide and in the UK, the age you should start taking your blood pressure and checking your blood pressure, the implications of having high blood pressure. We've looked at treatment and the implications of not having treatment or stopping your treatment once you've started the treatment. And we've also looked at the myths around hypertension. So we really have covered a lot in this interview. So I want to leave the final word with you, Professor Ibi. What is your final word of encouragement to the listeners?
I think what I would say is that hypertension is a silent disease. It doesn't cause symptoms most times, and it is preventable. So is the consequences. And so what I always say is that you should know your numbers when you get to a certain age. And know your number means lifestyle changes, knowing fully well, especially if you have come from a family with a strong family history of higher blood pressure, which is common in the Black ethnic communities. So I'll say that you should engage in healthy eating, physical activity, do exercise, reduce your alcohol consumption, and keep an eye on your weight. And in terms of your healthy eating, one of the messages that you should reduce your salt intake, knowing fully well that the Black ethnic community population has more tendency towards salt and water retention. And so I think those are the things. And the final message is that if you're now diagnosed with high blood pressure, please, it is not a temporary illness, it's a lifelong illness, and you should take your medications and you reduce and avoid totally the consequences of hypertension, which affects three main organs: the brain, the heart, and the kidneys. And that can make a big change in your life.
Thank you so much for joining me. Thank you so much for the information you shared about hypertension and CKD. I know that this information will help so many people. So thank you so much for joining me.
You're welcome. My pleasure.
Thank you for listening to Diary of a Kidney Warrior podcast. And don't forget that you can contact me on social media using the handle Diary of a Kidney Warrior. Please do subscribe to the podcast and please do tell a friend. New episodes of this podcast are released every other Monday. Until next time, take care and choose to live.
Diary of a Kidney Warrior, sharing faith, knowledge, hope, and love.